If you would have told me a few years ago that I would be a heart patient, I would say no way. My husband and I got married on March 17th, 2018. On the honeymoon, one morning, I woke up and I was just combing my hair. I felt this extreme pain between my shoulder blades. Then the pain started going down my left arm. And I called out to my husband and I asked him to bring me an aspirin. We were just really perplexed. In the back of my mind, I knew something was not right. That's why I asked for the aspirin. He wanted to call 911, but when the pain subsided, then I felt okay, but I kept taking the aspirin. Something was telling me to keep taking the aspirin. When we got back from our honeymoon, it was my husband's first day back at work, and I was writing a stressful email. And that pain came again between my shoulder blades. And I had called my mom to just let her know what was going on, and she convinced me to call 911. When I was talking with my mom, the worst feeling was thinking that I would die while she was on the other line. By the time they got here, the pain had subsided, and then they hooked me up to the EKG and they saw abnormal ST elevations. So they had asked me where I wanted to go, what hospital, and I said I wanted to go to St. Mary's Hospital, and I'm so glad that I did. I was immediately surrounded by staff, and I felt like I was in great hands. When I first met Dr. Tester, he was very unhurried with me. He took his time to explain everything, and I felt at ease with him right from the get-go. I have something called SCAD, Spontaneous Coronary Artery Dissection. So part of the artery comes loose and it causes constriction, so the blood flow wasn't going to that part of my heart. I had a stent placed in my LAD, which is called the Widowmaker, which was kind of ironic because we were on our honeymoon, and so it all came as a shock. Don't ignore the symptoms. Don't ignore the arm pain. Don't ignore the back pain. Don't just think it's going to go away, that it's heartburn or anxiety or indigestion. Call 911. Something Dr. Tester told me, if something doesn't feel right, it's probably not. And I think that's great advice. I did cardiac rehab, and I'm so thankful that the staff at St. Mary's, they recommended cardiac rehab, and so did Dr. Tester. It was very nice to be looked after and to know that your heart's okay. Part of my recovery was walking up and down my driveway with my dogs, and it was a slow process, but every day I could feel myself getting stronger, and I'm pretty active. I like to do yoga about 3 times a week, and I got back to all my normal activities, and it feels wonderful. I feel like myself again.